Good morning, everyone, and welcome to the AdventHealth North Pinellas virtual roundtable discussion. We're so excited that you joined us this morning. My name is Christina Grice, and I'm the Director of Mission and Ministry at AdventHealth North Pinellas. And we're really excited that you're here with us today. Here at AdventHealth, we believe that to deliver whole person care, our workforce must reflect the diversity of the communities we serve. As a matter of fact, one of our core values is inclusiveness, and that defines our culture. So before we begin, I want to invite you to see a short video outlining diversity, equity, and inclusion at AdventHealth.
If the world could see everything through a child's eyes, it would be a much better place. Where friendships were made because of a love for hopscotch and tag. And you weren't excluded because of the color of your skin. What you believed in, where you're from, who you prayed to, or what you looked like. A time when differences not only didn't matter, but seemed to not even exist. Where everyone felt a sense of belonging, treated like a child of God. And everyone had a seat at the table. We grew up, and somewhere along the way, we stopped seeing the world through those same eyes, leaving some of us feeling as if we no longer belonged.
It's feeling as though I'm being judged.
Based on what I look like.
The way I think.
The way I am.
And not the work
I produce.
Our service standard, love me, applies to every person every time, regardless of any barriers. Because it is our differences that make us stronger, more creative, more innovative, more like the communities we serve, helping us become even greater. Diversity and inclusiveness isn't about a box we check or a number we meet. It is about all of us, all wanting to belong, feel valued, and loved for who we are. Inclusiveness is more than just a core value. It is what makes us AdventHealth.
If you just join us again, welcome to be here with us today. We're really excited, and we have 5 wonderful panelists, and I'm going to let them introduce themselves. So we have Jason Dunkel, Jennifer Seeger, Belinthia Berry, Latasha McFarland, and former Mayor David Archie. So I'm going to let them introduce themselves and tell us about their role in the community.
Well, I will go. Good morning, everyone. My name is Jason Dunkel. I have been honored to serve as CEO and president here at AdventHealth North Pinellas for the last 3 years. And I've been in the community for 6 years, and I'm originally from the Tampa Bay area, grew up down in Brandon. So good to be here this morning.
Good morning, everybody. My name is Jennifer Seeger, and I am the Chief Nursing Officer here at AdventHealth North Pinellas, and I've served in this role for 4 years, but I've actually been at North Pinellas for 10. I used to be the emergency room director. So I'm very excited to be here today. Thank you for having me.
Good morning. I'm Belinthia Berry, Director of Corporate College with St. Petersburg College. I've been with the college for 6 years, and I'm excited about this virtual roundtable discussion today.
So good morning, my name is Latasha McFarland. I'm the Case Management Director, North Pinellas. I've been here approximately, with the organization approximately 7 years. I've been in the community all my life, right? So North Pinellas is my home. I've been in the community 3 generations now. So I'm excited this morning to have this discussion. And again, welcome everyone.
Morning. That's a good way to start off on mute there, you know. Hi, my name is David Archie. I'm Executive Director of Citizens Alliance for Progress. We operate a neighborhood family center known as Union Academy Family Center. Some people affectionately call it the CAP Center, where we have holistic activities for both children and families. Also, I'm former mayor of the great city of Tarpon Springs.
Thank you, everyone. I have to say that I think the one phrase that was the most popular in 2020 is "you're muted." You're muted. But this is 2021. So going back to our virtual roundtable, here are some of the topics that we would like to cover today. We want to talk about working at AdventHealth North Pinellas, our culture, some career opportunities. We also want to talk about ongoing partnerships between AdventHealth North Pinellas and our community. We want to talk about the ongoing DEI, and you're probably going to hear this acronym quite a bit. DEI stands for diversity, equity, and inclusion. And we're going to talk about some initiatives that will promote the diversity within our facility. And some other questions. If you have any other questions as you listen to our panelists, please feel free to write them down on the chat portion of your screen. You'll see it right at the bottom of your screen, and then we'll address your questions. So also I wanted to remind you during this discussion to please turn off your cameras and your mics. That way we'll run a little smoother. So let's begin our discussion. I have one question to our AdventHealth team members. So tell us what it's like to work with our hospital, in our hospital, our culture. Even Jason, when you speak, please tell us about some of the initiatives that we did to support our team members during the pandemic.
Sure, I'll take that one to start. When I welcome new employees at our hospital, I always tell them it's really like having a big family, that they're joining a family, and I tell them, welcome to the family. You know, the reasons I say this is because it's true. When you walk around the campus, you feel like a family member. People greet you, they smile at you, they pray with you, they ask you how you're doing. They're actively engaged in your life. And I think some could argue, you know, maybe too much because the family dynamics can creep in there. But no, we are a big family here. One thing that we really promote, and I tell this too to all new employees, I say, here's how you can be successful at North Pinellas. And it's really activating our service standards. It's love me, right? That's what our patients want us to do, and our coworkers love me. They want us to keep them safe. They want us to make it easy, and they want us to own it. And so I say, if you can do those four things, you will be successful at AdventHealth North Pinellas. And I can see that resonates with them because that's different for many of them than what they've experienced in their work careers. So they're very excited and eager to come here. And so I would just start out by saying that we're a family environment and we have service standards that take the expectations to a very high level.
Jason, can you tell us what AdventHealth North Pinellas did during the pandemic to support our team members? Because those were not easy months or year.
Yeah, so it gets back to the service standards, loving them, you know, making sure that they were supported, that they were heard. We listened to them a lot. We made sure that they were safe by securing PPE. And you guys all remember, you probably haven't forgotten what PPE is, but you haven't heard about it over the past 6, 7, 8 months because of the efforts to acquire more PPE. So we really worked hard in those areas and support, you know, saying that we're in this together. We also kept their paychecks whole. We didn't lay anyone off during the pandemic. I think that's remarkable. When you think about that, you think about providing childcare. We started with, okay, what do our employees need right now? What do our team members need through this pandemic, and we built a strategy off of those needs. Simply put, that's what we did. Very proud of the efforts that AdventHealth made and what we did here for our workers in our community.
And I'll just tag team what Jason said here. As far as what makes AdventHealth different, I think is the holistic care. So we not only look at the patient for their physical well-being, but their mental well-being and also their spiritual. And I know that it is, I've worked in other organizations where we've had a chaplain in the hospital system that came and went. We have them on staff here, so they're able to meet the patient's needs, also meet the community's needs as they're interacting with visitors, they're interacting with the staff. They make it very easy to seek guidance throughout your day. So that makes us very unique. We've got other things that, our service standards, I want to make sure that everyone understands that our service standards doesn't just apply to patients. It really does apply to each other. When we say love each other, we make sure that we are definitely interacting with one another. I know it was difficult through the pandemic. And the one thing I think we heard more consistently, at least among the leaders, is that we really missed each other. We missed interacting. We missed getting together. And even if it was in a meeting where you sit across the table from your counterparts or your peers, we really missed that feel. So now that, we've been vaccinated and we can start to still respect social distance, but get together more often, that is definitely something that we are all excited to do. And so I just think that that holistic approach that we apply to not just our patients, but also to one another is what sets us apart. So that's where you get that culture of family. And I think that's how, it continues to disseminate from the top down. So Jason, he was instrumental, I think, in the executive team and making sure that they feel that from the top and that reaches the bottom of the employee staffs, or that it reaches the patients. So I think that's what sets us apart.
Yeah, and I'd like to add to, in addition to the family feel, much like a family, it's important that everybody in this hospital has a voice. And especially during the pandemic, we had never been through anything like this before. So we all had to pull together and come up with ideas. And really, what does our frontline workers need? They're the ones at the bedside. They're the ones that were taking care of these patients with this new disease that we knew so little about. So it was really important for them to feel like they were heard, that they were valued, that they were included, and that we loved them. And I think that really is what set us apart. When the rest of the country was really struggling, we really put an emphasis on valuing each other, and we needed to hear everybody's voice. And you don't always get that at a lot of the hospitals, especially during a crisis.
Thank you. So Jason, I have a question for you. This hospital has been here for a long time. So give us a brief overview of the history of AdventHealth North Pinellas in this surrounding community.
Sure. I would say we had a very diverse beginning. And so in 1988, the hospital was renamed. It went from Tarpon Springs General. And I'll say this quickly too. The governance and the board of Tarpon Springs General was always represented by the community, by civic and religious organizations. So in our bylaws, we had to be represented by different elements of our community and groups in our community. So that too has still remained today and made us who we are. So in 1987, that would be the last year that Tarpon Springs General existed. The name was changed to Helen Ellis Hospital. We had a significant gift at that time by A.L. Ellis, who was a banker in the community. His wife was Helen Ellis. And then when she died in 89, the name was changed to Helen Ellis Memorial Hospital. Continued that way. It was a standalone hospital until University Community picked it up, I believe, around 2000. From 2000 to 2010 was with UCH, University Community Health. And then Florida Hospital came in and we acquired UCH and its collection of hospitals, one of which was in Tarpon Springs here. And that was our organization, which was previously known as Florida Hospital, acquired UCH in 2010. In 19, we changed our name to AdventHealth. And here we are today. So, but we think about the connection. AdventHealth, Battle Creek, Michigan, really founded on holistic care, healthy living, lifestyle. And that same thing was really happening here at the same time. And now AdventHealth is here to carry that legacy on forward.
Thank you. So there was several administrations have been leading this hospital. So now my question is to Mayor Archie and Valentia and Latasha, since you grew up in this community. From a community perspective, can you please share perceptions from the community about AdventHealth North Pinellas?
Well, I'll start out. And just listening to what Jason was talking about, and as someone said, I've been around Tarpon for a long time. So some of those transitions I've been able to witness, and some of the things in terms of the perception, because I've been elected official, plus living in the community, it's a variety of perceptions. One, from some people, it's a great hospital, and they are very caring. But there is also some mistrust, and some of it predates AdventHealth in terms of not trusting the medical system. So some of those things still exist today in relationship to how am I going to be treated if I go to the hospital? What's going to happen to me? Who do I see in terms of when I'm in the hospital? Do they really care about me? So there's that perception, and I always say perception is reality, that there's a certain amount of mistrust from some of the individuals that's from within the community. So.
And I would have to agree. I think some of the hesitancy comes and it stems and it's deeper than the Tuskegee experiment, but not having proper treatment to care for their illnesses, misdiagnosis, self-diagnosis, and not being a self-advocate in our community. We don't advocate for ourselves when we're with doctors. So that's where that mistrust comes. But it also is rooted in family values and beliefs. I do believe in, with my own mom, she tells me all the time, hey, just put alcohol on it, just do this. We do all these different things, natural herbs, we don't eat right, and we don't want to tell our neighbor what's going on with us or the church members. And so far few and many, when I look at it, there are not many individuals who are in specialty fields within the hospital, such as doctors, different nurses, and does the organization look like the community you serve? And that's what we've been talking about here. I always say you can't be what you can't see. And so that's why I believe education and industry, which is healthcare, should come together to put that trust back into community by educating them.
And so just as a community member, again, born and raised here, I will definitely say that through the history of this standing facility, so prior to AdventHealth, there was definitely some obstacles or some opportunities to overcome. I think that AdventHealth has done a very good job by employing from the community. We've also been able to, so again, I think what we're referencing here is representation. So that to me goes a long way when you're talking about what Valencia was talking about, when you're talking about institutionalized racism. So, and how it factors into the healthcare system. And going back to Tuskegee and going back to those histories, I mean, you can go all the way back to the Civil War, when the Black veterans were denied health care and disability. So I mean, bringing that all the way forward and actually being able to stand before you today as a representation of AdventHealth, someone from the community, but not only from the community, but a representation of the community. So I think, we have come a long way, and I think Jason has done a very good job by making sure that he wants to partner with the community so that we can understand some of those perceptions and hopefully change the reality.
Well, thank you. Thank you for those insights. So appreciated. Jason, tell us a little bit about what you are doing, what the hospital is doing to improve these perceptions and this reality, because perception is reality, right? And also what we're doing to partner with the community. Tell us about those initiatives.
Yeah, it's interesting, kind of in the context of COVID, I think obviously a lot of things happened last year. It was the toughest year, I think, for our country. If you think back what we had to endure, just beyond COVID in our communities with racial tensions and divisiveness and the election, of course. There were so many things that were happening that it was sad how it pulled so many people apart, and social media and all that stuff was kind of a really bad cocktail, I think, for just our society in general. And it just struck a chord with me. I'm a person that I love collaboration. I love people. I love being together, and I love getting the best out of partnerships. And so in response to the situation last year, just really wanted to bring our community together. And I thought, okay, the hospital has a chance to shine right now and to bring our community leaders together. There were signs outside of our hospital that were calling our workers heroes. For the very first time, I'd never heard heroes used to describe a healthcare worker. And that was remarkable. The drive-by prayer vigils and people supporting our frontline staff and leading up to the Super Bowl and how our team was finally treated as heroes. It's just, thinking about it brings chills to my spine as I sit here today. But all of that just struck a chord with me in my heart. And I wanted to do something as a response. And so like we did with our employees, it's the same strategy. We brought in our community leaders, African-American leaders, along with the chief of police, because they're a big part of the solutions here to our problems. And we said, let's talk. And not me, we wanted basically to hear. So it really wasn't a let's talk, it was let's listen. So we brought in a group, several reverends, Edwards and Milton Smith, Taureen Mathis, who's a police officer, Chief Cochin, and we just listened to understand and then to say, hey, what can we do to make our community better? And what has transpired since, and I can be very honest with this group and whoever's listening, it was uncomfortable for me. I wasn't sure what I should do, say, not say, and they kind of put me at ease because they said, Jason, look, you're just the fact that you're here, you guys are here listening is what you should be doing. And so feel comfortable in this environment because you're doing the right thing by just listening. And then as we met after that, we weren't quite sure what our strategies would look like. But like I said, we just wanted to come together and bring more good to our community. And what has happened since then is we have a clear roadmap and strategies for ways in which we can work together, such as bringing in our youth in the community, showing them opportunities in the hospital, getting them thinking about becoming a doctor, a nurse, working in food services, nutrition services, a CNA, whatever. The hospital is like a city here. We have so many roles. You talk about a diverse workforce. We have diversity in skill set and across the board here. So we wanted to find a way to introduce our youth in our community at a young age to turn them on to perhaps a career. Also talked about maybe a clinical pilot, knowing that African American males and females suffer from cardiovascular issues at a disproportionate rate. So we wanted to maybe look at that and said, all right, we're a hospital, let's lead in that way. How amazing would it be to actually affect the health of a group of individuals because we took the time to just get a baseline and work with them on diet and maybe some medications and interventions. And so we're really excited about the potential for that. I'm going to also do some listening sessions in the Black community where I just go and listen. And if 50 people show up, I'm just going to listen and we're going to go back and forth so I can learn more about what's going on in this community. And I think that was really at the heart of what we're trying to accomplish. We just get together, we'll listen, and then we'll go forth with some action items. And I think COVID did derail us for a little while, and we're still working on getting those plans fully implemented, but we will make it happen. Oh, and one other thing is a job fair for our African American community. How amazing would that be? We have a job fair here. We this next year, we're wanting to hire 240 new people at our hospital in Tarpon Springs. Think about that. That's a big number. And so we want to make sure that we get the word out and that we work in that community as well with a job fair.
If I could, I'd just like to add to that, and sitting down and talking. And one of the things was it was somewhat emotional in talking about some of the things that each of the individuals sitting around the table had experienced. But also it's one of really trying to look at what are some solutions. I mean, because, as Jason was talking about, it's good to talk about, their problems. But unless you're going to have some type of solution, unless you're going to look at doing something, then people get weary on just talking about, there is a problem. So, in terms of trying to even take it outside of that one room, as Jason said, and looking at from a community perspective, because everybody has an opinion and people want to be heard. But they don't only want to be heard, they want to know that you're going to do something that's going to affect their condition. It's good to talk about from a health perspective that you have a problem. But, it's one of trying to take that to the next level and say, okay, there is a problem. Now let's look on what can be done to resolve that situation. So what's been started, we're very hopeful that's going to make a difference. And the one thing is looking at dealing with the youth is that, people have to understand that there are a lot of jobs that they can get, and reaching out and showing them that there are some opportunities. But after you show them opportunities, then some things need to transpire. So that's one thing that we're looking for is some of the results of listening and not just, be talking for the sake of talking. So.
Thank you. Jason, what about initiatives within AdventHealth regarding diversity, equity, and inclusion? Can you talk a little bit to that? And Jennifer and Latasha, you're welcome to also share some insights on that one.
Yeah, so clearly a diverse workforce is a richer workforce, and we can pull from people's backgrounds, their history, their worldviews, regardless of what those are, to make us better. And so that's what we're wanting to accomplish here. We really need to represent our community here. When they walk the halls, they see folks just like them. And so I think that's one of our goals. And I think we've made good strides this last year in hiring to make sure that we represent our community. So we started there with taking a look at our hiring practices. Now, COVID environment was very challenging because, we were losing nurses due to them wanting to go to travel assignments in California, New York, and throughout the country. And so it's just been very challenging, you know, from a recruiting standpoint in general this last year. But we still made strides with getting and attracting a more diverse workforce. I think that we've done things on our campus, you know, as far as putting committees together. I know we're working on one with wanting to hear, like we did with our community, from our staff members who are diverse and from minority communities. And so we're working, putting together groups to hear and listen with them. The division and AdventHealth has also done a tremendous amount of work with the DEI Council, which has led to unconscious bias training for all of our employees. So all of AdventHealth employees have gone through that training as well, just to try to recognize where we're all falling short or have blind spots, because we do. We just do. We were raised a certain way, and that lends itself to blind spots, whichever way that was. And then listening sessions too, from the divisional standpoint. So those are some of the initiatives that we've done to encourage, or I should say, to put a framework around inclusion and more accountability around making sure that we're inclusive.
And also, I think we've had an even increased emphasis on really, we don't want everybody that thinks the way that we do. We need to broaden our minds, you know, with a different worldview. There's going to be more creative ideas and expressions. There's going to be solutions brought to the table that somebody that thinks just like us or that's experienced the same, you know, everything that we've experienced, then it's going to be a blind spot, like Jason said. So even with our hiring process, we want this hospital to be a reflection of our own community that we're serving, which means we want to provide opportunities for people that are living right here. And if you have a queasy stomach and maybe you don't want to do patient care, there's a lot of things that you can do here in the hospital and make a tremendous impact. And like Jason said, we have so many different job descriptions, and we want to be a solution, and we want community members that are going to be here, that are going to trust us, and they're going to brag about the joy that they get to experience when they come to work every day in their own community where they live.
Yeah, I think one of the things that I found the most riveting was the unconscious bias training. To be able to sit across from your peers and have those discussions and hear and share stories of where you may have experienced bias or may actually identify a bias that you didn't know you had, identifying those blind spots. But I think what AdventHealth did, and when we talk about interventions, and I think that's what we've all been saying, is we've heard people talk before and people have listened. But when we talk about interventions, they provided every leader here with some training, and training to provide tools to be successful of actually leading in AdventHealth. That's huge for AdventHealth, to make sure that their leaders receive the education, the training, the tools to be able to lead accordingly and to be able to carry that mission throughout everything that we've done. And so that was the biggest, I think, takeaway for me on actual interventions. So often we are just either in a meeting and you're listening and you're trying to, but when we actually develop action plans around something that is centered around inclusion, diversity, and equity, that's huge. So I think that's, as a leader here, that's one of the things that I say that AdventHealth was able to do that I think put us, heads above the rest, for sure.
Thank you. Now, I know that some people have joined us because they have an interest in some careers at AdventHealth, opportunities, what it looks like. So I want to switch gears a little bit. And this question goes to any AdventHealth North Pinellas team members. So what does AdventHealth North Pinellas look for in an ideal candidate?
Well, let me take this. And I love this question, and I'm going to go back to when I greet our new employees when they come in the door. I say that there are two types of workers, and I'm going to put it very simply today. There's the ones that get out of bed every day and say, I get to go to work, and the ones that say, I have to go to work. Now, which one do you want taking care of your loved one? It's pretty obvious, right? The one that says, I get to. The ones that say, I get to, are the ones that come to work with purpose every day because they understand their why. And so we more than anything, we are asking our employees, not asking, I would say this is a demand. We're demanding our employees understand their why, their purpose, their motivations, the big picture as far as why they do what they do. And if they can come to work every day and deliver on that to every person they come in contact with, this will be the best hospital, not just in Tarpon Springs or North Pinellas. It'll be one of the best hospitals in the US. And so that's what we strive for, because if you take care of patients you don't know, like you're taking care of your mom, because you have purpose and intention behind that, they're going to be cared for at an exceptional ceiling, right? I mean, there will be no ceiling. They're going to have the best care in the world. So, and I don't know if Jen wants to piggyback on that, but it's just what we expect here. We've done a lot of work around our why and understanding what gets us out of bed. And if it's not for you, it's not for you. We don't want the people that say they have to come to work. We want the ones that say they get to.
Yeah, kind of to add on what Jason said, you know, when people come to interview for a job, we know the fact that they're interviewing, they've met the bulleted points for the job description, right? But you can teach somebody how to be an RN, how to be a physician, how to work in dietary, but can you teach someone how to be nice? It sounds so simple. And it's really about, to Jason's point, when we have orientation and we want everybody to understand their why and then share their why, because as their leaders, maybe they're going through a hard time, and just reminding them of their why and their drive and their purpose can reinvigorate them, especially, you know, during this last year when people were tired and they were scared. When they can connect to their why and that driving force, and they love what they do and they're nice. I mean, that's integral, I think, in the hiring process. And that's what we really want to see here, is people that are nice and that have joy.
And Jen, let me put you on the spot. Go ahead and share your why.
So my why, you know, whys evolve. So initially when I was a teenager, my mother, she had cancer. So I spent a lot of time in the hospital, and I was oddly comfortable in the hospital setting. And then what really made me want to go into leadership, because I love patient care, was unfortunately a hospital, not in our community, but they made an error and my mother died. And so I said, I got to make sure this never happens again. I don't ever want a family to go through this kind of mistake that could have been avoided. And so that's what really catapulted me to wanting to get into leadership and to really focus on quality and making sure that whatever hospital I'm serving in, we're going to be the safest hospital in the community. And that's my driving force, and that why isn't going to change. But I know that I can make an impact with my story, and that nobody else has to go through that.
Thank you, Jen. And guess what? No coincidence that we are one of the safest hospitals in the Tampa Bay area. So, and Jen has been leading that charge for the past 5-6 years. So there you go.
I know through the, so just to piggyback on, you know, talking about the why, I know not only when we're looking for new hires, but to sustain our current employees. It was important to share when times got really tough. So through the pandemic, it was important for us to get together and remember why we're here. It was important for us to, you know, I had all my employees write it down and actually either post it up somewhere where it was visible during the day. So when you had that tough patient, or you had a tough situation that you were trying to transition a patient, or you had a tough situation that you were watching a family go through, just to remember why you're here. That was something I think that my team held on to throughout the pandemic. and we effectively stayed whole. And I think that, when we talk about it and we did our surveys and we do all these things, that's the one thing that I think my team felt the proudest of, is they remembered every day why they came to work, why they do what they do, essentially. And so I think that's something I think that if we could all remember, why we serve the way that we do in whatever form or fashion that is in the community, that will help us be able to serve effectively every time. So that's something that I will continue to do as I'm looking for new candidates, or as we're expanding because of growth. So that's a great thing. That's something we'll continue to do, is to look for people that can acknowledge their why and be able to stand behind that every day.
So to all three of you, tell us what areas in North Pinellas are we now currently hiring for?
I think I'll let Jen take that one.
Well, definitely we have openings for RN candidates, LPNs, certified nursing assistants. We also have positions in our operating room for people that maybe have curiosity about the operating room setting. They can be what's called an operating nursing assistant. And that way they can kind of navigate what route they want to go in on a clinical level. We also have opportunities for people that want to work in the laboratory setting. We have opportunities in our environmental services and in food and nutrition as well.
So I know I'm also, we have opportunities in our case management department. So we've got some social workers and RN case managers that we're currently seeking employment for right now.
Okay. Any other areas, Jason?
No, there were no opportunities for CEO. So no other areas. I think Jen covered it, but no, as I mentioned, we'll have over 200 positions available this next year. We just looked at this yesterday. So we're excited to bring in new employees and what they can bring to us. So
I want to switch gears again and talk a little bit about health equity. And I have a couple of questions. So the first one is going to be to Valencia and Mayor Archie. And you touched a little bit on it before, but there is some hesitancy among our community, some of our community citizens, to going to doctors. Can you tell us a little bit about that?
I believe that it's kind of what we talked about. Some of it is mistrust. Sometimes it's from a financial perspective, people don't have the funds to have a personal physician. But a lot of it is one of trust, and then there's a perception that, hey, if I go to the doctor, and it's not just within people of color, it might be more prevalent, but feeling that, hey, they're not going to listen to me. What's going to happen? Am I going to be misdiagnosed? It's a lot of various fears that people have, and a lot of it is because of environmental factors. Some people grew up not having a personal doctor. They only went to the doctor when it was one of, I need to go. And we know that a lot of things, you need to visit the doctor for is preventative care. So, but the biggest thing I believe is that it's just somewhat mistrust of the healthcare field. And Olivia talked about it a little bit as far as some of the things that have happened in the past to people. Those things are carried on in terms of people talking about the things. And the worst things that happen is the one that basically travels the fastest. So it's trying to overcome that type of mistrust.
And once again, I agree. This is the mistrust of being misdiagnosed, the whole self-advocate of, the affordability of it. Can I afford to go? And does the doctor really understand what I'm really going through? And a person's not going to be forthcoming, especially within our community. We've been, as I say, my own family beliefs, my mom will tell you to do something opposite of what the doctor's going to tell you to do. And so for me, I'm a very self-advocate. I do tell people, please go to the doctor. If you have a fever, if you're going through anything, we lack dental care, pharmacy care, OBGYN care. There are many women out there who have never been to an OBGYN, have received a pap smear, have high blood pressure because of the foods we eat. Because, I love my fried chicken and we love good food. But at the end of the day, we have to take care of ourselves, our bodies holistically. And I'm not even going to touch on mental health because we'll be here all day, because mental health is another key factor within our community that we'll go to the pastor, talk to him, we'll pray about it, and we'll dismiss all of the different problems that are going on within our household. And so we really need to take care of ourselves. And the only way that we can do that is educate, educate, educate. So what I love, and I heard Jason talk about, one of your strategies is talking about heart health, metabolic syndrome, diabetes, those things that affect the African-American, Black and brown communities, different communities of color, where we need to be educated on, because these are things that we live and breathe on our normal day lives. And so kudos to you all for having those type of educational seminars. Continue to keep doing that, because that's going to be key to making sure that we are.
Thank you. So I want to piggyback a little bit. Well, actually, we have a question, so I'm going to pause for a little bit. And there is a question about pharmacy positions. Are there any available? That came from our chat section.
Great question. And we actually do have a pharmacy technician position opened here at North Pinellas. So yes, we do.
All right, so another question regarding COVID-19 has affected the need for RNs. What are some characteristics of new nurses that nurse managers look for? And can you tell me what a typical day for nurses look like in your units?
That's a great question too. So we actually have a nurse residency program. So when there is a new graduate nurse and they've passed the boards, we do an interview process, and then we give them a 12-week program where they actually have a portion of didactic. So where there would be content in more clinical education to bring them up to the top of their practice, along with having them join with a preceptor who they follow during the shift for that 12-week time frame. And then, each month during that preceptorship, we're always evaluating their readiness. If the 12 weeks were to come and maybe they don't feel ready or as proficient, then we will extend that, because it's very important for us to set everyone up to succeed. We want them to take excellent care. And the last thing you want to see is someone that's not happy to be a nurse within their first year. So we are very much about proper onboarding and making sure that it's a good experience for them, a great experience. And so we take great pride in that graduate nurse program. If you are a new nurse, the nurse residency, we have a medical surgical unit that we can place our nurse residents on. We also have what's called a telemetry unit, and that's where patients have a heart monitor on. They might suffer from some different cardiovascular diseases and some more complex diseases. And then we also have a progressive care unit that we will train nurse residents to work on. And the progressive care unit is kind of what people would call a step down unit. So the patients aren't critical anymore. They're not in an intensive care setting, but they're still suffering from some complex conditions. They're having perhaps some complex medications. So we also train our residents to go into the progressive care unit. And then of course, for our experienced nurses, they can go to any of those units, as well as our intensive care, our operating room. And of course, we have the emergency department as well. And what we really look for, again, is you go back to fit and the culture that we're trying to have here of love. We want people that are nice, that are connected with their why, and that are ready to make an amazing impact on each other and on our patients.
And we only have about a minute before we bring this to a closure, a couple minutes. And I just want very quickly, we just came out or still coming out, let me put it that way, of a pandemic. And I think within our knowledge and within our power as a hospital in the community, we have done a good job managing this pandemic as well as we know how and we can. But there have been some side effects of pandemic side effects, let's put it that way. So what recommendations do you have to keep our community and for our attendees, to keep them healthy in spite of what we've gone through?
Well, I'll just speak to this quickly. If Jen wants to add anything, feel free. But, I think preventatively speaking, we need to do more. I was disappointed that I just didn't hear enough from the government, from people in general on the preventative side of things last year. Yes, we have a vaccine, but still get exercise, get sleep, drink water. It goes back to the basics. Take your vitamins each day. We have this disease out there, and make sure that your immune system isn't compromised. And I think that those are the things that we should be talking more about. And just because we have a vaccine doesn't mean that we don't need to concentrate on being healthier.
Thank you. Any last words, Jason, as we bring this to a close?
No, this has been great. And I just want to thank each of the panelists and those who have joined us. We look forward to more of these in the future, hopefully even in person at some point. Imagine that. And maybe this fall, if we're to the point where COVID has continued to be diminished, we can get together and do something like this in person, and maybe have it virtually as well. But we're here for our community. We're going to move forward, working with our community to do some amazing things over this next year. So we want you to be a part of that as well. So thank each one of you for joining us today. Christina, feel free to close it.
I wanted just to say that if you are here attending and you're interested in becoming a team member at our hospital, we want to invite you to apply for our open jobs. We're going to drop a link in the chat. So please, and come and join this family. They're here. Would love to have you bring your why and continue the mission that we have here. So again, thank you all the panelists. Thank you so much for your contributions, for being here with us. And thank you to all attendees. And we'll look forward to doing this again in the fall. Have a great day. Thank you so much.
Bye-bye.
Bye-bye.
Yeah.
Thank you.
That was so good. The chat was lovely. I don't know, DC, if we can get a printout of the chat and the questions that were in there. You guys got some really awesome comments.
Oh, I didn't see. I wasn't able to see anything in the chat. Just whatever you guys prepared for me to read.
Yeah, so you guys wouldn't have seen the ones that were actually happening in the event, but there were some really awesome expressions and gratitude, and some really cool things were said. So we'll definitely make sure to get those out.
How many people ended up joining?
We had a total of 51 at our peak, which is great.
Right.
Thank you, Mayor Archie, for joining us.
Yeah, thank you.
I think
Thank y'all for having me.
it was nice meeting you.
And Valentia, nice job. Thank you for representing.
Right?
You're welcome.
Good to connect with you again, Claudia.
Yes, it's probably good.
Y'all have to invite me back. I got to come by and visit you all.
Yeah, you do.
Yeah. I'll find stopping by.
Let's make other lunch. Let us know when you're here.